Globally, it is estimated that 1 in 7 of 10 to 19-year-olds experience mental health conditions, according to the World Health Organization. But some studies reveal many children experiencing mental health disorders simply go untreated. To learn more about the medications often used to treat kids and to take a quiz, we are now live with educational psychologist Dr. Karen Streeter, aka Dr. K. Thank you so much.
Good morning.
Okay, let's get right in. Why are we talking about this now?
Well, because as a school psychologist, I work with individuals every single day who have conditions that require medication and they won't take it. And it's called psychotropic medications, and these are medicines that adjust the chemicals in your brain to help with conditions like ADHD, depression, schizophrenia, etc. And so what I say to them is, it's like needing glasses, okay? So you can't see, you need glasses. So you can choose to wear them so you can see properly or not and just squint and see the world blurry. So that's what you're doing. If you need meds and you don't take it, you can function, but not well.
Oh my gosh, that metaphor, just amazing. Okay, so let's go through the quiz and talk about some of them. I mean, there are misconceptions.
Exactly.
Stigma, right?
Exactly. So let's see how many misconceptions you have or you get correct.
Oh no, then I'm the bad guy.
No,
Okay.
You're actually like
just
you're
following
every woman,
the general
every person
human
this morning, because everybody probably is feeling the same way you do.
I need to just say it.
Yes, woosah. So number one, they work immediately to provide quick relief. True or false?
Psychotropic medications. I would think, do you hear it takes time? Wait.
True or false?
I would say false because from what I understand, medicine takes time to build up.
It does. It takes several weeks to build up in your system.
So people think it should happen instantly,
yes, and they think it does. I talk to so many parents who say, oh, I gave my child medicine and they turned into a zombie. And I was like, well, how long have you been giving it to? As soon as I gave it to him. No, it takes several weeks to build up in your system. Yes. Number two, taking psychotropic medications can change your personality completely. True or false?
Thought that was true. Like I thought that maybe some people can, just get really, really mellow.
False.
Okay.
So while some people feel like the medicine is making them act differently, it is actually bringing them to who they truly are.
Oh.
Yes.
So they were already chill. Like you were chill as a human.
Exactly, exactly. So especially with children who have ADHD, a lot of times parents will say, oh, they just zoned out, they zombied out. No, ma'am, they're paying attention.
Oh,
they're being still like they're supposed to.
Oh, wow.
Yes. Wow. So number three, all psychotropic medications are addictive. True or false?
I just, you know what, can I do both? I don't know. Like, okay.
You're like every person. Most people don't know. I hear a lot of people, and I don't want to do it because I don't want them stuck on medicine. That is false.
Okay.
Because there are some, and especially any medicine that you take inappropriately, that's going to lead to problems.
Right.
But there are some that are usually used for like anxiety or sedative types that can lead to addiction, but in general, most of them do not.
Okay.
Most of them do not, but you need to take them appropriately. Number four, it's safe to stop taking them whenever you want.
Okay,
True
see, I have a loved one who is, you cannot, right? Because it's like cold turkey and they end up, their minds can't handle that.
Yes, exactly. It's you should always have a doctor to titrate you off of the medicine.
Say titrate, what does that mean?
Titrate, that means you're going down little by little.
Okay.
You don't just stop it because number one, it can have a lot of bad side effects, withdrawals, and then a recurrence of the original symptoms.
Wow. Okay.
Yes, and then number five, psychotropic medications are most effective when combined with therapy.
Oh, true.
Yay.
Yeah. See, I have someone who is battling this, and so I think I probably know a little bit more about.
Good. That's good.
So, except for that,
and everybody knows someone who probably should be on medication and should be going to therapy. So it's not a quick fix. It does get you in terms of the way your chemicals are working in your mind. It gets them balanced, and then the therapy helps with the behavior and the triggers and all of those sorts of things.
Okay, when is the moment you know that you need them? Wait, did you have another one?
No.
Okay,
that's it.
how do you know that you need medication?
Okay, so it's all about how serious the condition is, the severity of it. So let's say you're diagnosed with ADHD, but it's a milder case of it, and you can do it with some behavioral changes, some environmental changes. But if once that occurs, you're still having problems every single day, and it's interfering with your ability to live a good life, you need to get some medication.
Okay, and so how do you get the medication?
So you talk to your doctor. Your doctor is always
Like the primary
first.
doctor?
You can talk to your primary doctor.
Okay.
Sometimes they will prescribe, or they may tell you to go to a specialist who will then prescribe, and that could be a neurologist or a psychiatrist or some other type of doctor.
On the screen right now, you have a list of things. You say,
Yes.
be honest, right?
Yes.
You want to go down that list
Yes.
real fast?
Definitely be honest with your physician about previous problems, about your family history, because that's how they're going to guess which one you need to have. Always talk about the side effects. Be patient. It may take several weeks before you get all of the adjustments you need so you can live a good life and have the right med for you.
Ask the questions. This was so enlightening. Thank you so much for
Thank
helping
you for
so
having
many
me.
people, Dr. K. And you inspired our question of the day. It's a conversation that's getting louder in homes, schools,
Yes.
doctors' offices. And now we want to know what you think. Okay, our 11-9 question of the day is, should children be medicated for mental health? And it looks like somebody's already voted. So it's
wow.
yes, no, or depends on the situation.
Yeah.
So hover your cell phone camera over the screen, and you're going to see a yellow bar pop up. Tap that, and then you can make your choice. We're going to check in midway through the show and share the final results before we wrap things up. Thanks, Dr. K.
Thank you.